When is hand-foot-mouth disease most contagious? Have you ever wondered when hand, foot, and mouth disease is at its most contagious? This viral illness is common in children and is usually caused by Coxsackievirus A or enterovirus 71. It leads to mouth sores and a rash on the hands and feet. Knowing when it is most contagious is key to stopping its spread. Hand, foot, and mouth disease spreads mainly through direct contact. This can happen through respiratory droplets when an infected person coughs or sneezes. It can also spread through feces, especially if someone comes into contact with contaminated food or water. Additionally, the virus can be found in blister fluid or oral secretions. It's important to note that the virus can survive on surfaces for a short time, which allows for indirect transmission. So, when exactly is hand, foot, and mouth disease the most contagious? Individuals are most contagious during the first 48 hours of their illness. However, they can continue to be contagious until the rash and mouth sores heal, which typically takes about 7 to 10 days. In some cases, people can even spread the virus before any symptoms appear. This is because the virus can remain in the stool for several weeks after recovery. To prevent the spread of hand, foot, and mouth disease, frequent hand washing with soap and water is crucial. Cleaning and disinfecting surfaces regularly can also help reduce the risk of transmission. It is advisable to keep children at home from school or daycare until they are no longer contagious to help prevent outbreaks. Parents and caregivers should pay close attention to hygiene practices, especially in places where children are in close contact, like daycare centers or schools. Teaching children about good hygiene habits, such as covering their mouths when they cough and washing their hands often, can significantly help in preventing the spread of this illness. In summary, while hand, foot, and mouth disease is most contagious during the early stages, maintaining good hygiene practices is essential throughout the entire duration of the illness. This approach will help keep everyone safe and healthy.